we had 27,879 tests, and it's down from the previous day. And again, I'm just encouraging people, please come out and get tested right across the state. Those testing numbers are important, as I keep saying. It influences the decisions we make as a government. It's important that we collect that data to give us confidence that when we make those decisions, we're doing it in the best of public health, in keeping the citizens of New South Wales safe. Out of the 27,879 tests last night, there were 6 cases. All 6 cases were acquired overseas, with 0 cases locally in New South Wales, which is a tremendous result. But like in previous days when we do have some level of concern, this morning we've already had 1 case come forward, which does concern us. It is connected to the Avalon cluster and to the Avalon RSL, and I'll get Dr Kerry Chant to elaborate on that even further. Also today, of course, is the SCG test, and an update this morning from the Minister for Transport in relation to what is occurring with the public transport out to the SCG. It's running without issue. Our public transport, from rail to buses, have plenty of space. There are about 1,600 plus people already at the game. About 300 car spaces have been taken up, and traffic is moving quite good there at the SCG. Again, things are going quite well. Yesterday, we indicated and identified with Minister Hazzard the issue at the MCG about that individual that was tested, and we've made it absolutely clear that today, if you are at the test, we have mandated the wearing of masks for the whole day, except for when you're eating or drinking. And we are going to have a significant police presence to make sure people are doing the right thing. So we want people to enjoy the day at the test. We believe that the arrangement in place with the SCG and cricket is one that has de-risked the event as best as possible. There's always risk, and we're not going to pretend there isn't risk, but if people follow the rules, wear masks and make sure they socially distance, we believe we can put on a test today that will have minimal risk to public health. In relation to other events, I know there's been conversation and in the public domain about the A-League, and we are working with the A-League in relation to games, especially the upcoming game in Newcastle. What we have learned from what's occurred at the MCG, what we have learned in the preparation for today's test at the SCG, those sort of requirements, including the 25% cap, will apply to those games, and we'll work with the A-League. It's what we do. We want to make sure we put on sporting events right across the state that are safe for the public, but we also know that these events are important to the economy, and we believe we can do it in the best COVID way. Testing, as I said earlier, testing is still of concern. As I said, overnight a drop from the previous day. All week we've seen incremental increases, and I'm encouraging people again in New South Wales to come out and get tested. I urge you to do that. It is so important, as if we live with COVID, and to make sure the restrictions that are in place are the appropriate restrictions. And if there is an opportunity to lift restrictions in the future, and especially around the northern beaches, that data is very important. So that's why today my plea again to everyone in New South Wales is to come out and get tested. I know in the regions the testing's been good, and I thank all those in regional New South Wales, especially in places like Nyngan Orange and Broken Hill, because of the young men that travelled through that. And it's great to see those results at this stage are very, very positive for those communities. But just because you were tested yesterday, and normally what happens when we put out a plea, when there is an issue, people will come out on day 1 or day 2. What we're asking people to do is to continue to come out and get tested if you have any symptoms or if you feel not quite right. So with that, as I said, and I'll recap, 27,879 tests overnight, 6 cases acquired internationally, 0 cases locally acquired. A great